benefit that I have I have received from this trip is firstly see with my own eyes that our citizens are safe, secure, happy, treated well, and are managing the job in a foreign country. That is the first thing that I did. Japan is a very strict nation. They're very conservative. So it's very troublesome when we engage in employment avenues and opportunities like this. We have to be very cautious. Firstly, they're very particular about their language, particular about time, particular about their food, particular about everything. And their protocol is very deep. So it's important for us before we send more nurses, because they're asking us for more nurses. So you mean to tell me that it was wasteful? Certainly not. Yes, some people will speculate, but it doesn't really matter. I have done a good job by going and certifying by myself. These nurses are located in different parts of Japan. So Honorable CM did 2 locations, I did 3 locations. We have to verify. We have to make sure that we're sending our kids to a good place. And this is the first time that we're doing something like this. If people think that my trip was wasteful, they're entitled to think what they want. I also visited the shiitake mushroom. I also visited some other farms which are engaging in different forms of agriculture, drip irrigation. Then I have seen workers, because now they're asking for people in the agriculture sector also. I was wondering, why would they want somebody from Meghalaya to go and work there in those sectors? When I went there, they were manned by Nepalis, by Vietnamese, by different people. So it's important for us to know where we're sending our citizens. Important for us to go back and check, keep a tab. That is something that I have done. And I feel that by myself going, I have learned so much. In the shiitake mushroom cultivation, we have learned that there is a requirement for a certain kind of a wood. In our state, felling of such trees is not possible. What is the alternative produce? What is the alternative product? We have to think, we have to experiment, we have to exchange ideas. We have the weather, because their farms, they had to reduce the temperatures to suit our ideal temperature here. We have a problem. We need to know how to sort out these problems. So we are finding out ways and means, because if you have to engage productively in any activity, if you go by yourself, you learn. And that's exactly what I have done. And if anybody thinks it's wasteful, then they're entitled to think like that. But I don't need a certificate from them. I have justified my trip, and I think what I did was the right thing to do.
Can you tell us how many are there nurses and what is the prospect?
Together.
Yeah, altogether.
Altogether, 26 nurses will go in the first, second and third batch. 10 more are being requisitioned now. We need to figure this out, because there is a misconception that these nurses go to Japan and just take care of the elderly. They don't work in hospitals, they don't do this, there is no future, I found out. So even a nurse from the state of Meghalaya can become a certified nurse in Japan after 5 years of service. They have to do an examination, a qualifying examination, and they're working in proper hospitals, proper setup. Certain nurses are caregivers, certain people are working in actual hospitals. So it's important for me to know, and I feel that I have done the right thing to do it.
Will you be taking up with the institutions, especially NEHU, to have a Japanese, maybe they may be having, but to go aggressive?
IFLU is already running a full-fledged graduation program. Not sure whether it's a PG as well, or is it just graduation. That is not the level of education that a nurse will need. A nurse will need a different level of education. So Navis has actually now authored a book that is going to be convenient and easy to learn. So we are, or we will have to in the near future, consider a language skill in our nursing programs. We've seen now that this is the inevitable, whether it's Hindi, whether it's Tamil, whether it's Bengali, whether it's any caregiver, anyone in the health sector, even doctors, have to pick up the basic language. Fortunately, because of experience in outreach programs and all that, they pick up. But some of our people need language skills. Some of the skills, some of the trades in the state also need language skills. We need to see how we can do this, at which level of education we need. But it's not going to be a graduation or post-graduation level. You're asking a university to include a certain curriculum, a certain language in their curriculum. That's a different thing. These people need language skill, because that is the only language that is spoken by the people of that nation. So people going to Singapore, even some of the English by some of our nurses is insufficient. We have to give them a language skill. Even if it's English that is convenient for the people of Meghalaya, most of the people of Meghalaya to speak, but you still need to have a specialized program. You need to include it in curriculum. So if we're thinking of such revamping of courses, then we have to make sure that we know what we're talking about.
Can you also tell us the feedback from the countries which...
So in Japan, our nurses have become very popular. That is why 10 more nurses are being requisitioned now. Interview is currently being held. And work permits for Japan are far more simpler. Nurses don't have to go for certified programs. Say for example in UK, if we are sending the nurses to UK, they have to clear the UK examination. So that again, we have to start coaching our nurses. So nurses who have finished the basic course should not just sit idle at home. I think we should have packages of learning for all of these nurses. You see the All India exam, nursing exam, what's it called? NORCET. Even the NORCET exam cannot be cleared by our nurses. We have to do something. When you know that you have a lot of these trainees or trained specialists in this kind of a service, we have to go as policymakers. You have to exchange. You have to go. You have to learn. We also went to Thailand. Thailand has the best health facility, recognized the world over. They are dealing with HIV/AIDS is number one. They are dealing with commercial sex workers is number one. So you mean to tell me we'll just sit in Meghalaya and then expect to know everything? We are policy makers. Part of our duty entails innovative interventions. And innovative interventions can only happen if you allow us to do what we have to do. And you can be sure that when we are doing all of this, we're doing it with a sense of responsibility. 8 o'clock in the morning we would leave, we would return at 12 night, 10 night. That was not a vacation, a paid vacation, definitely not. Well, some people may want to think that way. Well, please be my guest and think whatever you like. But I know that what I have done was productive, was good, and needed to get done. And today I'm in a position to understand how to prepare our nurses in the future. We have a very, very abled talent for patient care. Our people are very friendly people. Our people are very caring people. Our people are very, they have all the soft skills required. Now you just have to make sure that you empower them to face that international market, which is very much there. You cannot say that we'll not send and we'll not do and we'll not. We cannot. You cannot keep yourselves, you can't pin yourself. You cannot cage yourself. You have to do something productive.